So I do want to talk about how we can do population health in corporates and some of the case studies that we've seen. So I want to start off by talking about the pain points. When you think about employee benefits in the workplace, companies' biggest pain point is the rising cost of insurance and healthcare. In the last year, it was 10%. That is way higher than salaries, way higher than inflation. Why is it happening? Well, their employees are aging and there's a prevalence of chronic disease, as you've heard over the last few days. Companies try to have wellness programs to combat this, but they have no return on investment data to show that it's working because their healthcare cost keeps rising every year. At the same time in the workplace, because of COVID, there's much more consciousness of mental health for the employees. Also, companies do want to have the employees tailored to their health. Someone who's about to retire is very different from someone who is young and single and healthy coming into the workplace. So one size fit all benefits don't really work. Whereas married couples find that if they're both working for different companies, they both have family coverage. And since you can't submit a hospital claim to two insurance company, you have duplicated coverage. And anyone who has submitted a hospital claim knows how burdensome it is to get reimbursed. So a lot of employees have to pay out of pocket and wait a long time for that receipt to be reimbursed. When you look at the value chain, you can see why this is happening. Employees submitting a claim has to go to HR goes to the broker goes to the insurer checks with the TPA. Then if they have checkups or wellness or telemedicine, every single thing is fragmented. None of this is connected. But what if we built a platform that integrated all of the providers, digitize all of insurance so it's no longer a physical receipt with long reimbursement times, and we capture data at the source? What would that look like? It would be a platform with an ecosystem of all of the players where it is seamless. Why is this important? When I was running Mercer and Marsh, my largest Chinese client said to me, "We bought insurance from you, but you know what we discover? We discover too many late stage cancers." It was too late. And what they asked was, why can't someone connect the health screening as well as the chronic disease management and the prevention and the wellness and the doctors all together, and also have insurance just in case? Why can't someone connect treatment and prevention and early detection? So that's what we built. We connected the entire ecosystem, built it all in one app. So it's a company-funded super app, and anything and everything to do with physical, financial, and mental health is all in one platform. What does that look like? The first thing to do to enable employee choice is to actually build a company-funded benefits wallet. That way, the employee can decide what is best for them and their families and their health needs. Where does the funding come from? It's actually from what the company is already spending for group insurance, for outpatient, for dental, for screenings, for optical, for wellness, or if employees sell their annual leave because they haven't been traveling during COVID. And with that wallet, the employee decides how they want to spend it. Why is it beneficial to a company? The company finally gets a fixed, predictable healthcare budget, just like salaries. And the employee is responsible for their personal health. And the company decides the incremental increase every year of that budget, just like what they do with salaries, instead of allowing insurance companies to tell them, hey, here's another double-digit premium increase. So it gives control back to the company. So how does it work? The employee first, during enrollment, enrolls in their insurance benefits, but they can decide the levels. So if you are married to someone else who is covering the whole family, you can opt down to the lowest default coverage. It could be sharing a room with 4 people in a restructured government hospital. Why? Because you're going to use your spouse's private plan with a 1-bed. Or if you're like 70% of Singaporeans and you have integrated shield, that also duplicates group hospitalization and major medical. So you can opt down to the lowest coverage. No HR will allow you to opt out completely because they're afraid, for the liabilities. Then you free up money in your wallet. And with that freed up money, we've built a marketplace where that money could be used all year long for physical, financial, and mental wellness. And it's everything from mental health counseling to more insurance, to diabetes management, to healthy nutrition, to vitamins, to physical activity like yoga, gym memberships. But it actually allows the same company money that they spend now to be used for treatment as well as prevention. We also have an assessment so that each employee can actually assess their lifestyle, because most of chronic disease is due to lifestyle. And to gamify it, we have each employee upload a picture of their face and we age their face according to their lifestyle habits. Admittedly, this only works for women because men still look at their faces and think they're handsome no matter what. And what we do is we give recommendations on ways to improve their health and wellness vendors who can help them stop smoking, get screening, get healthier nutrition, more activity, better sleep, or to help with stress management and mental health. We also integrated deep integrations with the telemedicine providers, the health screening providers, the mental health providers, and the COVID tests. And we've seen a huge surge in demand over the last 18 months. So the app actually becomes your everyday app. In case you get sick, you need to search for a doctor, you find out you have a chronic disease, you want medicine delivered to your house, you want to keep your medical records. And for insurers, since they will reject you if you have a chronic disease, a pre-existing chronic disease, we try to get employees to buy their critical illness before they discover their chronic disease. But the medical record is the app. So the app keeps your health screening record as well as your pharmacy records, as well as your claims, your diagnosis. What we also found is that companies want tools to help engage their employees during lockdown. Not Zoom, not Teams, but step challenges so that employees can compete in teams, and win on the leaderboard and win more dollars in their wallet. But what we found that really worked was allowing employees to take pictures of their exercising, their meditation, their walks, their family time, their healthy foods. Admittedly, a lot of people put their junk food here, and your colleagues can comment. So it allows for social engagement and fitness at the same time. And what we found is that people are coming in 11 times a day and over 20 minutes a day just to check where they are in the leaderboard, encourage their colleagues to start walking or running and posting more pictures. Now, it's the data that we capture from integrating with HR platforms, with the insurance companies, with all of the health providers that help us do population health and help for us to nudge employees with the right health tips, the right care plans, the right insurance offering so that they're properly covered and protected. So you can see we actually get a lot of demographic information because for insurance, you need to know the age and the gender. Also, we cover for dependents. So we know when people get married, we know when they give birth, we know when they join a company, we know when they leave a company. Also, because a lot of corporates want us to do financial wellness, we help with financial assessments. I've talked about the lifestyle assessments. We get the lab data and behavioral data. But all of this data allows us to personalize with the right care plan for population health in the workplace and the right education. And we've been working with the Health Promotion Board on the right education. So what that allows each company in the workplace to do is to stratify their population at work into those who are healthy, those who are at risk, which is most of the population, and those who are already unhealthy. And using that data, they can target the right interventions to improve health. The types of reports that we have are pretty vast. Everything from utilization to claims to benefit selection to health screening to lifestyle, census. So here's my own staff. So you can see they're mostly inactive. There's some body fat. No one says they're an alcoholic, but everyone lies on this question. Junk food, body pain, not everyone's taken their health screening. There's some poor sleep habits, and only 1% admitted they were stressed. But also look at the biometric data. So you can see 4% are obese, 27% overweight. Blood sugar, so pre-hypertension and diabetes, you can see the risks here, but you can correlate this data. And what we do is we only provide HR with anonymized aggregated data because of data privacy. So we used to work with the largest corporates. We actually work with 500 large companies in China, in Hong Kong, and in Singapore. We just sold off our brokerage, and now our technology is used for SMEs and retail. So we decided to scale the platform. And here are 2 case studies so that we could work with SMEs and individuals. So now we work with the insurance companies and their bank partners because their bank partners have lots of SMEs. And over the last 6 months, one of the insurers actually onboarded 200 companies, 80,000 users during severe restrictions when no one was walking into the branches. People are still not seeing their agents. So the digital platform that we built for large corporates could be used for smaller companies. Also with one bank, we work with the retail customers where the bank came out with a health is wealth campaign. How can we help get you discounted telemedicine, discounted COVID tests, and now soon pre-departure COVID tests bundle with cheap travel insurance. So tailored to the needs. Why are the banks and insurers doing this? It's because we made it economical for them. Otherwise, they're just insurance, just banking. But because of the data we have, since we know when people join a company, since we know when people get married or give birth, Asia is different from the West. No one will marry you if you can't buy a house or a car. So that gives the bank the opportunity to offer discounted mortgages and discounted auto loans bundle with homeowners and auto insurance. Before you leave a company, in case you're unemployed between jobs, they can offer life and medical insurance at a cheaper rate because you're coming from a job. Also, we are part of the whole healthcare journey to keep you healthy, to treat diseases, to get you well, and to manage your diseases and to help you live longer. So it really is along the whole continuum of your work-life events and your health journey. And in the workplace, what we found is even though the company doesn't pay for everything, we found that if you give the right education about insurance and the need to stay healthy and the need for early detection, in China, where we work with a manufacturer with 6,000 employees in 10 different factories, 30% of them were able to use payroll deduction to get health screening and to buy necessary insurance for critical illness. What we're seeing in the workplace, both in large corporates as well as in SMEs, is that there's a convergence of health and wealth. People want to retire healthy. And so what are our learnings about population health in working with large corporates and white labeling for insurance companies, banks, payroll companies? Workplace population health can be funded by company spend on insurance and healthcare, especially because there is so much duplicated coverage for married couples or countries with integrated shield. And so that money could be redeployed into early detection, chronic disease management, and prevention. But to work, the platform has to solve very specific company pain points. You have to help them tackle the rising costs of healthcare with the fixed wallet. You have to be able to capture source data. It's not employees entering the data, it's connecting to the healthcare ecosystem and capturing that data, but encrypting and anonymizing and aggregating that data to actually comply with data privacy. You have to actually engage employees by allowing them to personalize to their parents, to their children, to where they are in their life stage and healthcare journey. And you have to have wellness challenges to engage them socially. And there has to be a reward mechanism in order to nudge for healthier behavior or for losing weight, stopping smoking, reversing their diabetes. The customer journeys have to capture the moments of truth when they think about their health. So you have to be there at the health screening. You have to capture the diagnosis and the drugs for the telemedicine. You have to actually be there to help with mental health, to talk to a counselor or psychologist. You have to make sure they get covered with insurance just in case they need treatment. And you have to be there on the wellness journey. Also, the payment mechanism has to be there and in real time. Could be a payroll deduction, could be a payment gateway, could be a company funded wallet. Also, technology is just an enabler. It's online to offline. So you must provide a human touch and link them with the clinics, link them with the telemedicine, with the insurance specialists and the wellness vendors. So why don't I pause to see if there are any questions?
Thank you, Rosaline, for such an interesting insights that you shared. Well, I'm happy that my company is taking care of me, but I'm also concerned they know too much about me. I mean, now that they know which health screening did I go for, or probably they know what kind of treatment that I choose. Is there too much of information being shared with the employer, and are employees even comfortable?
Yeah, so none of that is shared with employers. It's actually encrypted data and it's only anonymized, aggregated data. It's never personal data. Your employer, the insurer, is never allowed to see personal data, especially with PDPA, HIPAA, and GDPR. So the level of data they see is what I showed in those tables, where it doesn't get smaller than a group of 10. So they can't identify you.
Okay. So as you mentioned, right, as employees move from maybe one company to another, I mean, we wouldn't be able to track their longitudinal health. How would the platform be able to help?
Yeah, so what we do is we allow terminated employees to stay on the platform because that's where their medical records are. What they lose is the company funded wallet and the company funded insurance, but they still get their medical records. They still have access to discounts for telemedicine, for mental health, for wellness. So they get to keep that.
Okay, great. So in that case also, maybe just one more question. Based on your data, what will nudge behavior, carrot or stick?
It's actually both because so we have the carrots with the rewards, where you get more dollars in your wallet, but the stick works for some people. So what we found as the most effective stick is the fixed wallet, right? You have to pay for extra insurance if you run out, if you're very, very sickly, right? If you need to see so many doctors because you get a fixed amount, it's not unlimited. What we also found during the wellness challenges is when you have groups of teams competing against each other, the most effective teams have their manager as the leader. And the teams do not get any points if anyone in their group is not walking, right? Is not participating. So it's the peer pressure of you do not want to disappoint your manager. So it's not the healthy we're worried about because they're highly motivated, is the sedentary. And I don't want to get involved. So companies that have these compulsory department against every other department, but the boss is the head of the leadership of each team, we find that super effective, right? Because you don't want to be the laggard and all your peers are looking at you and you want to win the prize of more dollars, more vouchers, more team lunches. So we found that really, really effective.
Okay, good. So we should start getting our bosses moving. So yeah, thank you very much, Rosaline, for today. It's very interesting and sharing with us with our CXA platform. Thanks a lot.
Thank you.